Maybe it's just taking a minute. All right, there we go. So for today's training, we're actually just going to, it will probably be fairly short. We just wanted to provide some updates that we thought it would be best to share in the group. Also, if there are any pressing questions or concerns that you have that you'd like us to address, again, those can be shared in the chat. And if there's something we can address today, we will. If not, we'll address them via email or in a future training. So the first topic we wanted to give you an update is on the public health emergency. As you may recall, there is a federal public health emergency, and as a result of that, we've been able to make some adjustments to our operations, and that's under Appendix K. And so that has been extended. The public health emergency has been extended for another 3 months. They extend it in 3-month increments. And so it was extended on July 19th of this year. So it will be extended at least another 3 months. And we anticipate that it will be extended again. And then just as a reminder, even when the public health emergency officially ends, we will have a transition period of several months that will allow us to transition from how we were operating under the public health emergency to prior to COVID times. So basically, we've got probably a good amount of time that we're going to continue to operate under Appendix K and then time to make those adjustments. With that said, I did want to make you aware of a couple of updates under Appendix K. So Lainey is currently working on making updates to our provider guide. If you remember, we've generated a provider guide that outlines changes under Appendix K. So she will be updating that and sending that out. But we wanted to draw your attention to one specific update, and that is we will be resuming disenrollments for individuals who are not meeting level of care. So as you may remember, previously, if you had identified that an individual wasn't meeting level of care, we weren't disenrolling them. However, we're going to go back to pre-COVID times and resume disenrolling an individual. So what we will need you to do is, if you're already aware of an individual who wasn't meeting level of care, or if you identify individuals who aren't meeting level of care, you'll need to go and conduct a new MDSHC assessment to confirm their status and whether or not they are currently meeting level of care. If you determine that they are not meeting level of care, please submit the DPF2 and the assessment to the new choices waiver to the incident email. So if you remember, we have 2 separate emails. So you would send that to ncwincidents@utah.gov. Marisol, Riley, and Anna man that email account, and they are going to be coordinating DPF2s. So please make sure to send that to that email. And then just a note that individuals will continue to have Medicaid coverage either through Age Blind and Disabled program. They just won't have waiver coverage. So wanted to make you aware of that, and you can go ahead and start conducting those assessments if you are aware of individuals who do not meet level of care. I also wanted to provide the opportunity for any feedback around areas that are currently addressed in our Appendix K that there are still lingering questions, or you would like additional clarification, so that we can make sure that's addressed in the update. So if you want to go ahead, if you have anything, feel free to unmute yourself and share that. We'll just wait a minute or two to see if anybody has anything they want included in that updated provider guide. You can
Amelia?
Yeah.
Hi, I was just recently looking through all the guides for directions on alternate transportation in a case of emergency, but not COVID.
Oh, okay.
We had somebody that was being evicted, and we had a weekend or evenings involved, and I wasn't sure what options I had at this point.
Okay, great. Thanks. Thanks, Melissa. That's something we'll make note of, and we'll get back to you because I'll need to confer with Lainey on that, but we're making note of that.
Okay, thank you.
Yep, great. Anything else specific to Appendix K or how we're operating under this public health emergency? Okay, great. Well, if you think of anything throughout the training, go ahead and feel free to put that in the chat or send Lainey or myself an email, and we'll try to capture that in this release. The next update we wanted to provide was on SAS Forms and update to the guidance. So a couple of updates there. We sent a draft guidance, revised guidance to CMA supervisors, and thanks to those of you who provided feedback. We also, on the 20th of last month, we met with supervisors and other staff to get feedback on challenges associated with directing self-administered services, and there was a lot of great feedback. We really do appreciate the insight that you as case management agencies provided. There's a lot that we're just not aware of since we're so removed from the process. So it was really insightful and helpful. And it definitely brought to our attention that our guidance is missing some important information. And so we are going to spend some time beefing up that guidance, particularly in the area of monitoring and oversight for individuals who are utilizing SAS, and then also steps to take if there are concerns about their capacity or if SAS is in their best interest, what steps could be taken to assess that, and if termination from SAS is ultimately determined to be the most appropriate, what would that involve? So we are working on adding that information. Because of that, my goal of having SAS ready actually today to share, or even next month, is going to be pushed back a little bit. So Krista and I are working on that, and we have set ourselves a goal of having that guidance ready by the end of the year, if not sooner. So stay tuned for that. But in the event, because we knew that was going to take a little longer, we did go ahead and update all of the SAS forms. And so those were emailed this week to CMA supervisors. If you did not get those forms or you have questions about those forms, please reach out to me directly. But at the very least, we wanted to make sure that you had current forms. I know there was a lot of confusion about which forms should be used. So please make sure to make a point of disregarding any old SAS forms that you had been using and using these new ones. The new ones have a date of July 1st of 2021. So that's an easy way for you to remember that you should be using the forms that are from July of this year. Any questions or comments on SAS or those forms that went out earlier this week? Okay. Well, again, if you have any thoughts or questions, again, please feel free to add them to the chat or email us. There were a few questions or updates we wanted to provide around incidence and level of care screening versus our actual determination. So I'm going to turn a few minutes over to Marisol to talk through those updates.
Thank you, Amelia. So we did receive a question, and this is actually a really great question, as I've received this question recently more often, and it might be relating to the quarterly self-reviews. This is one of the questions that some of the case managers had. So what is considered an unexpected death? And we wanted to staff this and provide the clearest expectation for what an unexpected death. More than anything, I think people were curious as to what they should be submitting for incident reports that related to unexpected deaths. So we're going to ask you to submit incident reports for any unexpected death except for those clients that were on hospice services at the time of their passing, and that death was not related to an adverse event. Another situation where you would not be submitting an incident report would be if the death was due to natural causes. So, for example, those with general system failures or terminal and chronic health conditions. And if that seems to still be unclear with you, I would definitely suggest you staff that with your medical staff. And, you know, when in doubt, err on the side of caution and just send the incident report to the New Choices Waiver Incidents inbox. And then one of the New Choice Waiver staff's members will be making that determination. All deaths relating to an adverse event should be reported as an unexpected death. And so hopefully that gives you some clarification. We are looking to update the incident report brochure. So that's definitely something that wasn't necessarily addressed. So we're hoping to do that in the pamphlet. Does anyone have any questions on what an unexpected death is? Okay, and so just for clarification, again, you're always going to send an incident report to New Choices Waiver Incidents when it's a death, with the exception of those that are on hospice that have not passed due to an adverse event, or those who have had a general system failure or a terminal or chronic health condition, and we'll see whether or not we investigate those. In regards to level of care screenings, you know, we wanted to also send out that the expectation that we now have New Choices Waiver staff. We have Jen and Krista currently who are reviewing and doing a preliminary screening, which is where they're looking to see if the applicant meets minimum standards required for nursing facility level of care based on the administrative rule. There has been a common misconception that the level of care screening process conducted by New Choices Waiver is the end all, and that this is sufficient for determination of acceptance onto New Choices Waiver. And this is incorrect information. The level of care screening conducted by New Choices Waiver staff is done in an effort to avoid sending new referrals to people that clearly do not meet the requirements of the administrative rule. And so this is done in recognition of your time. The CMA will be making the final decision, and they'll be making that determination as to whether or not they meet for New Choices Waiver nursing facility level of care. The expectation of CMAs is that your agency's RN conduct a more thorough screening to ensure that records are correct, that the applicant in fact meets nursing facility level of care, and that no health and safety concerns exist that would endanger the client if he or she were discharged to a community-based setting and enrolled onto New Choices Waiver. So we did want to clarify that for you as well and provide that expectation. Were there any questions on the new process for level of care screening from New Choices Waiver? Okay, so I think that's pretty much it, Amelia, as far as those questions.
Great. Thanks, Marisol. Appreciate you clarifying those 2 points. And as Marisol mentioned, we have made some changes in how we are looking at our level of care, and Jen and Krista are more involved in that, freeing up Marisol's time to focus on some other activities. However, just to provide some additional information regarding that, if there are any health and safety concerns or questions that Jen or Krista do identify in their review, Marisol will conduct a secondary review. So again, we're trying to do a thorough pre-screening so that referral sent to you really do reflect those individuals that we feel are meeting level of care. But as Marisol mentioned, ultimately the final determination lies with the case management agency. The other thing we wanted to talk about today was training topics. So some of you may recall earlier this year or the end of 2020, I'll be honest, I don't know how you all feel, but I feel like my days just blend together and I can't believe that it's August 12th of 2021. But we conducted a training survey. So we reached out to each of the case management agencies and provided some topics that we thought might be of interest for these training meetings, and also gave the opportunity to provide feedback on topics that weren't listed in that. And so I wanted to share that list with you. We realized that we hadn't ever shared the results with you, and just go over real quickly and get some feedback as to what's missing from the list, and if anything on the list really stands out as being a priority. We rely on this list to identify topics for each of our monthly trainings, and so we definitely want to make sure that we are selecting the topics that you all feel are a priority. So let me just share this with you. That's probably a little hard to read, so let me make it a little bigger. Hopefully you can see that. If not, we'll kind of talk through it. So in our training survey, we identified key categories that were based on certain functions or expectations of the program, and those are in bold. So as you can imagine, when we administered this survey, it was COVID-19 and Appendix K expectations was definitely a priority for everyone. And so we've talked about that and we've addressed that in multiple settings. The next area where we wanted feedback was around application. So some subtopics around applications were just understanding how we conduct our review of applications, specifically how the 10A is used. There are some questions specific to those who are applying through the assisted living pathway, specific to how to the pre-lease agreement and proof of length of stay. Care plans was another topic that was identified, and just basically everything around care plans was identified of areas where additional training would be helpful. This one here, PCCP updates mid-year, has something that's come up quite frequently, and so we've identified that this is one that would be a priority for us, putting together a training and presenting that. CMA transfers, we addressed CMA transfers in a training and were able to issue updated guidance. So hopefully you all found that to be helpful, but that was an area that was identified in our survey. Incidents, just understanding a level 1 versus level 2, reporting requirements, what does a investigation entail, and one area that we are aware of that we need to address is reporting PHI and PII. So that's protected health information and protected or personally identifiable information. This was a new requirement that was added when the state implementation plan was updated, I believe, in July of 2020. So it technically is a requirement for reporting for incident, but we acknowledge that we haven't provided any specific guidance on that. So that's an area that we are aware that some guidance is needed. Health and safety checks, an overview and expectations, so just understanding what's involved in those. Freedom of choice, understanding our policy, what actions we take when we're identified of a potential violation of freedom of choice. Health and safety agreements was another topic that was identified. Specifically, when should agreement be put in place, and an enforcement of an agreement, how that should occur. Person-centered planning, we've done a little bit on this when we introduced the new PCCP with the addition of the section for accessing the community, but there's definitely more training that could be provided around PCCP, specifically for individuals, for example, who have a dementia diagnosis or other diagnoses that maybe present some unique challenges to conducting person-centered planning. Understanding level of care, completing the level of care form. It looks like, Tracy, you have a question about Section B diagnoses, and when we get through this, we can spend some time talking about that if you would like. But any, just clarifying how that form should be filled out and what we're looking for. Okay, thanks, Tracy. If you want to email me and just let me know a little bit more specifically what questions you have around that, we'll make sure to address that. And then some other topics were the medication review, the form, what to do when managed by the client, just some general questions. SAS, we know, and that's why we're working on that, and that's definitely a priority for us. The memory care letter, resources for home clients, housing resources, and balancing personal health and standards of care. So these were the topics that were identified in that survey. But as I mentioned, we'd be really curious to hear if you think anything is missing from that list, or which of these topics are a priority for your organization. So if you feel comfortable, go ahead and unmute yourself and share your feedback, or if you would prefer, you can add that to the chat. But really, this is your opportunity to inform the direction that we take with training. We're committed to having a training every month. And so we really want these trainings to be beneficial. And so getting your feedback on what those topics are is key to making sure that they're beneficial. So does anybody have any thoughts or suggestions?
Amelia, this is Wendy Dela Cruz with Advocates for Independence.
Hi, Wendy.
Hi. I, as an organization, I believe on our end, care plans are a hot topic that we struggle with at times. It feels like we are going one direction as we were told, and then the direction changes, and we only find out after a care plan gets denied. And we're not seeing consistency on how workers up at the state level are implementing some of the requirements of the rules. And so it's kind of a guessing game when we submit care plans a lot of times. Is it going to be approved or denied? And then these denials, and we're like, oh, this person wants this person wants this. So clarity in care planning, because it is a big component of what we have to maintain and do. And it is time consuming because the software and the program itself has got a lot of glitches with it. So we'd really like to know what the requirements are to make sure that there's a universal understanding of the rules.
Yeah, thanks, Wendy. And I that's a total valid statement. I think we recognize that here at the state, that there oftentimes are inconsistencies in how things are being applied, and we know that there's room for improvement on our side. So I appreciate you bringing that up. I think it would be helpful to know if there's anything specific that you're seeing that there is a lot of inconsistencies with, or there's areas where you feel that it's really out of line with the policies or trainings that you've been provided for before, just so we can narrow it down. And opening that up to anyone else in addition to Wendy too. I think knowing if you have specific examples, that would be really helpful.
Well, one example that comes to mind right now is when the change took place on some of the HCPCS codes, where it is a default of like daily or monthly. I did not recall receiving any type of information prior to that being implemented that was going to take place. So we have created service authorizations with the standard of like the transportation on a monthly basis. So now, because they have to match, we're spending time going back and correcting service authorizations to match the care plans. That's just one example. I knew it happened because it just occurred one day when I was working on a care plan, and then I think about a month later or a month and a half later, it was covered in one of these meetings. So that was an example of something being put into practice on your end, but not communicated to us on our end.
Great. Yep, that's a good example. And we do acknowledge that that was not communicated as clearly as it could or should have been. So thanks, Wendy. Any other examples that you all are seeing with care plans where you feel that there's a disconnect between what had previously been communicated or what had been the standard and then maybe how they're being adjudicated?
This is Melissa Cook with FlexCare. I know that you guys have a lot of new workers too, and so I found that a couple of annuals that have been submitted, like the PCCP, well, like this one for specific. My level of care that matches the MDS shows no transportation and shopping done. So I had an 8 on those two because the question is, in the last 7 days, have they done that? But on the PCCP, that's going forward, and we wanted transportation, and so she put on there that we wanted non-medical transport, and it was put on the care plan. So it was denied, stating that, why are you requesting transport if they're not using it? And so they had to go resubmit the care plan and everything, stating, well, the question is, like, the answers here are for the MDS that say in the last 7 days they haven't, but the client wants to go out, so that's why we're adding it on. So I think there's just, and I'm sure it's a learning curve because we have so much to learn, and I know you guys do too, that just the newer workers maybe don't understand some of it. Mm-hmm. So they're denying it on things that are, I guess, don't understand why we're adding things that maybe don't match somewhere else. I don't know.
Yeah, no, thanks. That's a really helpful point to make, and we'll make sure that we provide clarification and guidance around that so we're all on the same page. So thanks, that's a good one. Looks like we have a couple coming through the chat, so thanks. We're just making note of these. We won't necessarily address those today. Around care plans, and then Susie, some clarification around medication management. Okay, great. Any other comments around care plans or any other training topics that you feel are a priority?
Hi, Amelia. This is Jessica Hansen. I am with Envision Quality. Can you hear me?
Yep, we can. Go ahead.
Oh, perfect. Hey, so I am one of the nurses with the agency, and I know I've asked this a couple of times, and maybe you guys are working on a training module or whatever, or somewhere in sight, but I do have a couple questions and concerns about the MedCheck, the quarterly MedCheck forms that we're doing and all that stuff. I am super curious how other agencies are doing it, if they're just doing verbals and writing it on the form, if they're sending a form to the physicians and having them sign something as acknowledgement, or if they're just their process to see if they're just to kind of find out like the best way to do it. So I'm sure we're all doing it differently because it is so new that there are probably so many great ideas. And I think if we could all share our ideas of how we're doing it or what's working and what's not, it might be helpful to find the best practice for that. And also with the med checks for patients that are living on their own and are not in a facility, just the best way to go ahead and document that, since they're not having a facility staff administer and regulate their dosages every day. So just some questions and basically just to find the best practice of how to do that.
Great, thank you, Jessica. So, if you guys are monitoring the chat, you're seeing that medication management reviews has come up multiple times and align with those questions that you just presented, Jessica. So it sounds like a training on medication reviews would be most welcomed, and so we can definitely prioritize that. I did like the suggestion, Jessica, that you had of maybe during that training we can open it up and allow for some peer-to-peer learning and just hear from you all. You're the ones doing it, so I think there's an opportunity to learn from each other, so we can incorporate that peer-to-peer exchange during that training. So thanks, everyone. Okay, Tracy, training with ALF and case managers on communication and best practices. So it sounds like a training on bringing in ALFs of just how to communicate and work together Tracy, let me know if that's not what you were suggesting. Great. Anything else come to mind? Any other procedures or policy expectations that you feel are still unclear? We've addressed the medication review, which, as I said, we'll make that a priority. We've talked about care plans. We've done a lot of education around Appendix K, the public health emergency. Anything else that's coming to mind that could use some clarification?
Amelia, this is Susie from Utah Case Management. I just had one question, and I might be wrong, but I thought I read in a MIB that the HCPCS code chart had been updated, and I couldn't find an updated one anywhere, and maybe that didn't apply to our waiver. I'm not sure. Could you help me with that?
Yeah, great question. So the MIB, for those of you, that's the Medicaid Information Bulletin, and that's where we post updates or communicate updates to procedures or to our provider manual, did indicate that July 1st, the rate sheet was updated. Unfortunately, that rate sheet was delayed in being approved, and so I'll follow up with Lainey. I think we are very close to having that approved and then sharing that, but it's not currently available. So don't feel like you're missing something, or if you go on the website, I think it's still the rate sheet from 2019. There was just an unexpected delay by the time that the MIB went out and having that available. So as soon as we have that, we'll send that out. But thanks for clarifying, Susie.
Yeah, thanks. I thought I was going crazy.
Yeah, no, not going crazy. Great. Well, maybe you're thinking and pondering over other topics. I did want to share another update. We also reached out to case management agencies to get some clarification, because we oftentimes the feedback we get, and it's totally understandable, is that it's difficult to identify where our current policies reside, where our current forms are. And so oftentimes, unfortunately, that can contribute to some confusion because it's not easy to locate. And we heard reference of a binder, a white binder that existed before my time, and in chatting with Lainey, it existed before her time. So I reached out to the supervisors just to get a bit of understanding of that binder and how useful it was. And in that, the feedback we got from the majority of the case management agencies that sharing updates, whether that be policy updates, updates to manuals, updates to form on our website and via email would be most beneficial. In this digital age, it's really difficult for us to maintain any type of physical binder or physical resource that has everything. And so we rely on websites or emails. And so I hope that you've noticed that we have made a real effort to do better in communicating via email and getting those things out via email. However, we do recognize that sometimes finding an email that was sent 6 months ago with some forms or information could be challenging. So I am currently working with our IT individuals to make updates to our website. The goal being that it will be restructured and organized in a way that it will be hopefully easier to identify information, including posting our forms to the website. I know that hasn't been a practice in the past, but we recognize that having those forms readily available, the most current version of those forms readily available, will help you all. So we're currently working through that process, and I'm hopeful that it will be approved. It does require improvement because we are making changes to the layout. The other challenge that we run into with the website is the the process to post something to it can be somewhat lengthy. And so we're working and we're in discussions to identify workarounds or things that we can do so we can get information shared in a more timely fashion. So just wanted to update you that that's something we're working on. And if everything is approved, then we would be communicating updates via email to make you aware of those updates. And then forms and policies and guidance would be posted on the website. Wendy, just wondering, do others feel that there is so much that we need clarification on? The binder was very useful and detailed in most areas, perhaps making an electronic format. Yeah, I mean, I think if one of you would be willing to share a copy of that old binder with me, it would be helpful to see how detailed it was. I think we have identified that there's opportunities to make improvements to our provider manual to add more detail. So yeah, Wendy, if you'd be willing to share that with me, I would be happy to look at it and see how we can ensure that the information that we are providing is clear, and so we can hopefully avoid having to revisit things over and over again because our expectations aren't clear. Any other training topics or areas of clarification that you all can think of that would be helpful? Okay. And then I guess just to kind of wrap things up, like I said, this was going to be a short meeting today. Yeah, so just real quickly, Kathy, yeah, I'll revisit the changes to Appendix K just real quickly. And I think that's a good point in case anybody was a little late in joining since we addressed that first. So Lainey is in the process of updating the Appendix K provider guidance. And one of the changes that you will see in that is that we are resuming the ability to disenroll an individual if you have identified that they are not meeting level of care. So if you had previously identified individuals or you newly identify individuals, we're asking that you go back, you complete an assessment. If it's found that they're not meeting level of care, please email the DPF2 and the level of care assessment to the New Choices Waiver Incident email account, which is NCW incidents at utah.gov, and Marisol and her team will be coordinating that. So the takeaway there is that if you identified someone who is no longer meeting level of care, you can move forward with pursuing disenrollment based on that. And Lainey will be sharing that updated provider guide in the next week or so. Yes, Andy, you raised a hand. Go ahead.
I was just wondering, as part of that, do you know if we can purchase at-home test kits for people?
Oh, that's an excellent question. I have not heard anything. Marisol's taking notes for me, so she's going to make a note and we'll find out. That's a really good question now that those test kits are available. Great question.
All right, thanks.
Yep, we'll let you know. Any feedback on when Acumen will be closing out submitted T2038 claims? Sorry, Tiffany, I don't have, I'm not aware of any updates, but again, we'll go back to Lainey and see if she has any updated information on that. I know that's been a challenging process for a number of you, so thanks for being patient, but we'll see if we can get some clarification. So this is perfect. I was just going to open it up to see if there were any other questions that you have that you wanted to pose. Again, we may not be able to answer them in this moment, but we are taking notes and we'll follow up. So is there anything else that people are wondering about or wanted to get clarification on? Okay, well, wanting to be sensitive of everybody's time, so if there aren't any questions, we'll wrap up. Lastly, just on behalf of the New Choices Waiver Program, we wanted to express our appreciation to all the amazing work that you each do. We know that the last year and a half has been challenging, both professionally and I'm sure in our personal lives as well. And the dedication that you have to serving New Choices Waiver participants is noted and appreciated. We obviously couldn't do this without you. So thank you for your continued good work. And we really value the partnership that we have with each of your agencies. And so hopeful that you feel comfortable reaching out to us with questions or concerns, and we are working to be as responsive as possible. So please do not hesitate to reach out with any questions, concerns, or suggestions that you might have. And so just to end, just wanted to make note that our next training will be on September 9th. We'll chat with Marisol and her team, not to put them on the spot, but potentially we can do a medication review. That might be something that we can put together for September. If not, we'll tackle one of these many other topics that have been identified, and I'll send out an email just prior to that training to make you aware of what the topic will be. So with that, if there aren't any last minute questions or comments, we'll let you all go and get back to the work that you have to do, and have a great day, everyone.
Did you want to stop the recording?
I thought I did. Oh.